Today I'll be presenting my practicum, which I did at the Alberta Cancer Prevention Legacy Fund within my Provincial Health Authority, Alberta Health Services, or AHS. And my project was aimed at using data to drive impact. So to do that, I assessed the surveillance system needs of one group of stakeholders. So I'm just going to provide some background information to help you understand the context of my work. For those who are not familiar with it, surveillance is the systematic collection, analysis, and interpretation of data, which allows public health professionals to track and forecast health events and determinants. And it's useful because it allows us to do things like identify threats to public health, such as disease outbreaks or increased chronic illnesses, respond quickly to these threats by deploying resources effectively, and creating evidence-based policies and programs. And as previously mentioned, I worked within my Provincial Health Authority, AHS, within a unit called Population, Public, and Indigenous Health, which can be further subdivided into other divisions. But for simplicity purposes, I've only put two arms here: Operations, which handles common public health topics, and then Alberta Cancer Prevention Legacy Fund, or ACPLF, where I was located. And ACPLF is also broken down into many streams. And for my practicum, I was placed in the surveillance stream, which has two core functions. The first is to provide traditional surveillance support regarding cancers, as discussed in the last slide. And the second is non-traditional and contains an innovation mandate, which means that we have the capability to develop and test novel population health initiatives in the context of cancer based on evidence from the literature and other jurisdictions. And then once these innovations have been implemented and evaluated within our own unit, we then pass the information on to operations to scale it at a larger level. So essentially, we act as a hub for testing of new surveillance techniques that operations may not have the capacity to try. So we have a lot of new innovations currently in the works, but the one that we're focused on in this project is based on a precision public health model, which uses best available evidence to target certain populations that are underserved or have higher prevalence of modifiable risk factors. And one way to do this is through the use of something called geospatial and clustering analysis, or hotspot mapping. And I have an example I pulled from the literature here, and it basically shows a map with several areas that are lit up or highlighted. And this means that these areas may require a few more focused interventions. And hotspot mapping can be done with a variety of different determinants and regions. So again, there are many arms within ACPLF, and this image displays how surveillance is situated in regards to the other four streams, which include individuals and families, communities, workplaces, and health services. And surveillance is placed on the outside because we provide the support for these streams to take action on their specific areas. So the purpose of this project was to actually speak with these streams to see how we can improve our surveillance activities. Again, we spoke with four streams within ACPLF for this project, and meetings were in the form of semi-structured interviews, and our questions were developed to understand streams' proposed work and how we can help with the data support. We also wanted to gather some feedback on our hotspot mapping project. So some of our key findings: the first is the overall goal of ACPLF, and by extension the streams, are to increase preventive measures to decrease cancer rates and burden for three cancers: lung, colorectal, and cervical. And as you can tell by their names, the streams work towards these mandates at all levels, ranging from downstream at the individual behavior level to upstream at the health services level. And despite these shared mandates, streams all have their own priorities. So the individuals and family streams aim to increase HPV vaccinations by understanding and addressing the current messaging in Alberta to combat misinformation, particularly in high priority populations. The workplace stream aims to decrease smoking in priority employee populations, namely those who have higher proportion of smoking rates, such as construction workers, while the community team aims to decrease colorectal and cervical cancer in rural and Indigenous regions using the Healthy Communities approach. And then finally, the health services team aims to reduce the incidence of colorectal cancer by developing interventions and improving care pathways. And in theory, all of these efforts together will result in cumulative impacts on cancer status in Alberta. And along with these interventions, the streams will also partake in applied research to inform and evaluate their interventions. So this includes doing things, environmental scans, literature reviews, and longitudinal cohort studies following the rollout of their activities. So based on the discussions around Stream's proposed work, we were able to generate 4 main areas where the surveillance team can strengthen or address to help Streams meet their goals. And the first is by providing current snapshots of cancer status in Alberta so that Streams can prioritize their work. So this includes providing Streams with information about factors such as vaccination rates, screening rates, trends in these rates, Alberta-specific risk factors, and approaches and interventions that are currently being used in Alberta. And for the most part, this information has already been collected and provided, but this needs to be an ongoing process to ensure that the information is relevant and current. The second need is providing information on subpopulation context. So for example, how do these population-based determinants stratify across Alberta and its smaller geographical regions? For instance, the impacts of income and ethnicity on HPV vaccinations in Alberta may differ from those in the literature or other jurisdictions because of our socio-economic, political, and cultural differences. Thirdly, Streams also wanted to know the interplay and linkages between the determinants of cancer in Alberta. So studies often control for confounders, but our work is being implemented within dynamic environments. So in order to develop successful interventions, we need to somehow consider how the determinants interact within the Alberta context. And then finally, Streams also needed surveillance capacity to identify novel data sources. This is because as many of our projects are new innovations, so we need to look beyond current practices in data collection. For instance, one of the teams mentioned that they were assessing determinants of screening access, but so far have been limited to ambulance routes or distance from healthcare sites, while they were interested to see whether police patrol routes or crime rates made an impact on access as well. Finally, in regards to feedback on our hotspot mapping project, we found 3 salient messages. The first is that the Streams felt that the tool would address a lot of their data needs, particularly for prioritizing and understanding subpopulation context. But Streams also wondered if we would be able to present the tool in a more ethical manner without causing undue harm or stigmatization for certain communities by highlighting these negative health outcomes. So one way to mitigate these risks would be to integrate community assets like policies, programs, or community capital to highlight the strengths of regions as well as areas for improvement. And finally, we also discussed the potential of integrating work done within the Stream into the tools as another layer of data that can be used by stakeholders in the future. So for example, integrating the evaluation data, the environmental scan data, and the literature view data that will become. Based on these results, we generated a few recommendations. First, we know that central to the success of our group is to continue working cross-stream with team members to ensure alignment. So we're going to continue meeting frequently with teams while they finalize their projects to obtain a better picture of proposed work and data needs. And along the same veins, we're also going to set up meetings with other ACPLF stakeholders that we weren't able to meet with this time around. So that includes the Indigenous Stream and our evaluation team. Then we're going to cross-reference our data needs with current ACPLF surveillance capacity and develop a plan to obtain the data that we do not currently have access to. We'll also develop models to demonstrate the link and relationships between indicators. Then we'll develop a plan to integrate new internal and external evidence into the hotspot mapping project. We'll also explore how to present the hotspot mapping ethically without causing unintended consequences and stigmatization. And then finally, because we've only interviewed internal stakeholders so far, we'll also hold meetings with external stakeholders such as AHS operations and community partners to understand their data needs and feedback on what we're doing as well. So to conclude, this needs assessment identified several gaps and opportunities to improve surveillance within ACPLF. And we found that taking a collaborative approach can ensure that work is aligned amongst different stakeholders within our organization and can result in significant impacts on cancer screening, rates, burden, and the overall health of Albertans. So before I end my presentation, I'd just like to thank the Alberta Cancer Prevention Legacy Fund and my supervisor, Amanda Alberga, as well as AHS for the opportunity to do this practicum. And I'd also like to thank UVic PHSP for their guidance and support over the last 2 years. Any questions?
Wonderful. Thank you so much, Anne. That was an amazing presentation. I love the hotspot mapping. I'm a very visual person and I'm a data geek. And so that's both those parts of me are well satisfied with that. So
Yeah.
questions, please. You can even actually, if you have, even if not necessarily a question, but if you'd like to provide a comment, you can do that. I know folks are doing that through the chat box, but you're also welcome to do that verbally to tell Anne how much you enjoyed the presentation. No questions? I have a question, but I'm going to give others just another opportunity to ask a question if they have one. Okay. So one of the things I noticed in terms of the mapping, the hotspot mapping that you were presenting, Anne, is are you aware of geographic information systems? And forgive me if you mentioned this and I missed it. Have you heard of GIS?
Yeah, we are. That's something that's actually one of our other innovations that we're currently looking at in terms of kind of overlaying the two together.
Yeah, cool. That'd be great. I think there's a ton of potential there.
Yeah.
And certainly that allows like other sectors, there's lots of other work happening in other areas outside of public health with GIS. And if you're able to connect it together, that'd be really great, because then actually that could help to like bridge the different sectors and working on these areas.
And I think, sorry.
Go ahead. It's okay.
And I think that's a good point. And I think that's very important to public health is we're seeing right now that there's so many that health is in so many other different industries. Like we need to consider how we can work all together to ensure public health and population health remains safe, right?
Exactly. That's the basis of healthy public policy, and the importance of intersectoral work. And I think that there's great data can actually be such a wonderful bridging the different groups. Thank you so much.